Thank you all for coming this afternoon. I'm going to spend my 8 minutes telling you about what we're doing at the University of Bristol to teach students about evidence-based veterinary medicine and bridging practice to theory. All right. So at the University of Bristol, we're trying to teach both qualitative and quantitative evidence-based veterinary medicine to our students, and this is very much a work in progress. So we've been redesigning our curriculum. So far, we've designed years 1 and 2 and the final fifth year of the curriculum, and year 3 is starting to be redesigned. So we're trying to incorporate this across our curriculum, and we're doing this with what we call a vertical theme. So there are courses, there are lectures, there are tutorials, et cetera, that occur in each year of the veterinary curriculum. And like many of you in the room, I'm sure you'll agree that we want our students to have a solid knowledge of how to search the databases, how to design studies or how to evaluate study design in papers, and the basic tenets of epidemiology and statistical analysis. So our integrated curriculum involves a number of methods of teaching evidence-based veterinary medicine, including front-facing lectures, which was already talked about with Cindy, online teaching materials. This is a fairly innovative way that we do teach evidence-based veterinary medicine, and I'll talk a little bit more about that. Interactive tutorials where the students maybe sit in front of computers and have some staff and some tasks that they need to do with staff that they can refer to, but actually having them do it on the computers in front of you. And then creating critically appraised topics as well in the final year. And I include in brackets review sessions because similar to what other speakers have described, we found that having students present their critically appraised topics and discuss those in a forum with other staff and with clinicians was very powerful and very helpful for them to see, all right, this may be the papers that are published, but perhaps the papers that are published in Germany don't apply to the situation on my farm in England or the United States, et cetera. So we found that very useful. Unfortunately, the way the curriculum has changed this year, it means that we don't have a critical mass of students to be able to present those because they don't want to present just to themselves, really. So we do follow this multi-pronged approach. There are front-facing lectures early on in the curriculum about what is evidence-based veterinary medicine, how can we find and evaluate data, how do we interpret data, and then a number of lectures on statistics and epidemiology. We have some librarian-led tutorials, and I saw Emma Place come in, our fantastic librarian. Emma, are you? There she is. If you have any questions about this from a librarian perspective, Emma's been a fantastic help to us in creating this and enrolling this out and has a real enthusiasm for teaching students as well as staff how to do things like find the databases, access the information, what's behind the database, so what Google isn't giving you that some of the other databases will give you. Then we developed some online teaching tools, and this is Mike Steele, who used to work at the University of Bristol and now is at Elanco. And he had a real passion for evidence-based veterinary medicine and so made some great videos all around the site and around different places in Bristol, talking about the tenets of evidence-based veterinary medicine. He also used Camtasia software, which will capture the PowerPoint slides and has him talking over those PowerPoint slides in order to teach this. And this is a great resource because students can watch it at their leisure. They can go back and refer to it, and we can roll it out to a number of programs and a number of people across the campus. So in year 1, they learn about creating patient questions, and they watch these videos, and then they have some tasks that they do at the computers with Emma and with other staff members around them to answer questions as they're working through how to create these patient questions and what the databases give you when you input certain things, and do you need an asterisk or a $sign or whatever to get it to search the way you want it to. Then how the second year they have a tutorial on evaluating evidence, and in the third year how to critically appraise literature and how to create critically appraised topics. Then when we get to our final year rotation, we have students that are learning things that are clinically applicable, about to go out into practice, and here we ask them to create their own critically appraised topic. Now currently this rotation sits in a group of farm animal rotations, so these are all farm animal topics that they're looking at, but we ask the students to think about the time that they've spent seeing practice on extramural studies or in the clinic, and what are some questions that you came up with that you would like to know what the evidence behind is. And if they scratch their heads for long enough and can't think of a question, we do have a database that has come out of our farm animal clinic Monday morning rounds where we talk about, oh, I did this on this cow. Wait, what's the evidence behind that? I taught the students that. Oh, well, I'm not really sure, so let's put it in a database and have the students look up the evidence for those. So they choose a topic, they can review the evidence-based veterinary medicine principles that they got in lectures, they can go back and watch the videos again to refresh their memory, and we have some one-on-one small group time. This is groups of about 4 students in the final year that work on this combined with a population health assignment for a week. So they review those principles, talk about them, discuss them amongst themselves. Then they conduct a CAT and complete a template. And similar to the templates that Laura showed, we've developed templates where they have their question, they have a scenario that they show to tell us what the clinical scenario might be. They summarize how they did their search, what the terms were that they used, and what the results were, how many papers they found. Then we have them enter it into a very similarly structured template with the name of the paper, and so we can find them again, study weaknesses, etc. And then they come up with a clinical bottom line. So having summarized all of that, they say, okay, overall we think that using nonsteroidal anti-inflammatories shortens the clinical process of calf respiratory disease compared to antibiotics by themselves. So they complete this CAT template, they review this and discuss this with the staff member that's in charge of the rotation and amongst themselves. And then, as I said, we used to have a system where there were 3 groups that would be rotating through 3 different farm animal rotations. And at the end of these 3 weeks, we would have what we called a CAT club. On the Friday afternoon, somebody would bring brownies. All the clinicians would show up. All of the staff members involved with farm animal teaching would show up. And the students would present their critically appraised topic, and then we discuss it amongst ourselves. And it made for a lot of lively discussion. I think really taught the students that if you have a p-value, for some differences that might not be biologically significant, how do they translate that into practice? So we found that to be very powerful. Then we have the staff review these and entry into a database as well of all of these that the students have presented. So we did publish a paper on this last year in the Journal of Veterinary Medical Education, detailing how we use these online tools. And so if you want more information, you can look that up in JVME. And where do we go next? Well, we currently have more than 100 of these critically appraised topics in our database, again, only focusing on farm animal questions, but quite a lot of work that the students have done. We've been doing this for 4 years now. And we have a traffic light system for review, and we took this from the Manchester Best Bets physicians, where if it's a red light, the students have created it, but nobody has overseen it as far as had gone through and looked at it. It might have been discussed at the CAT Club, but no one's gone back and made any changes to it. If it's a yellow or an amber light, a staff member, maybe a clinician, has looked at it and said, yeah, this is pretty much right. I redid the searches. I found the same number of papers, etc. And once somebody with epidemiology and statistics background reviews it, then it goes to a green light, and we feel like that would be something that we would be happy to put out front-facing to members of the profession to assess. So what we'd like to do is to extend this to other species areas. Again, as I said, it's really just contained in the farm animal rotation at the moment, so we just have farm animal topics addressed, but we are looking to roll out research projects back into our curriculum, and so this may be part of the research projects that students could do in companion animal or equine and choose topics associated with those species as well. Thanks.